2015 challenge rests on the basic fact that change is easier for the NHS in the period after a general election than it is in the period in the run-up to a general election. After the 2010 general election, we didn't take the chance to make the change that was necessary because we had all sorts of other things going on. It's imperative after 2015 election that we do take the chance to make some significant change in the NHS in order that it remains sustainable. And for us, I think the 2015 challenge comes down to four things. First of those is that we want to go into the 2015 general election with each of the three main parties sharing an analysis of what the challenge is facing the health service. The second part is that each of the three main parties go into that election with strong vision about what the NHS and the healthcare system might look like, but without being too prescriptive about how you do that. Third part of the challenge is that we need to take forward the conversation between politicians locally and nationally and the NHS about what the NHS needs to do for politicians to support change. And the fourth part is that the NHS, when we get to the general election, has to be ready to know what change it wants to do. I really want the 2015 challenge to be involving as many of our members as possible. I think there are multiple opportunities to become involved, whether that is feeding into the work we will do on what the challenge is facing the NHS, or it's conversations with candidates locally about what the NHS needs to do to gain their support for change, or indeed it's local NHS organisations getting together to discuss what change needs to happen in their area.